The following presentation is on the prevalence of childhood asthma among females of low SES in Long Beach from 2005 to 2015 and is presented by Nancy, Aurora, Janet, Jennifer, Dambo, and Joshua. Modes of transmission. The modes of transmission for asthma is not distinctively known. However, the transmission of asthma has been attributed to genetics that can be inherited from a mother to her child. As seen in the image at the top right of the slide, prenatal effects such as maternal antibodies, placental maternal immune cell, and breast milk factors may result in more severe and lasting consequences of asthma by interfering with an unborn baby's critical developmental processes. The map presents the median household income by zip code in the city of Long Beach in 2010. A great majority of the map is highlighted in different shades of pink, which represents an average annual income between $30,000 and $55,000. The socioeconomic status of an individual or family can determine access to healthcare services and has been linked to different health outcomes, including respiratory diseases like asthma. Additionally, the importance of disease surveillance is stressed. According to the Tropical Health Solutions, public health surveillance systematically collects, analyzes, interprets, and distributes health data continuously to gain knowledge of the pattern of disease occurrence and potential in community with efforts to control and prevent disease in the community. Mechanisms used to control considered levels of prevention. Medications consist of oral steroids, anti-inflammatory medications such as sulfasalazine, and bronchodilators. Self-care activities like reducing the amount of cigarettes smoked in a day or quitting smoking entirely, and supportive care in the form of oxygen therapy would significantly manage the advancement of asthma. Seeking professional help from your primary care provider, pulmonologist, or a respiratory therapist is highly recommended, as these individuals are well educated on the function of lungs. Within the primary level of prevention, the expansion of education in schools and the public of the significant health risks of developing asthma due to secondhand smoke is highly encouraged through offering education courses at an individual's local community center. To further note the importance of education and effects of secondhand smoke, the CDC has reported secondhand smoke contains more than 7,000 chemicals, including hundreds that are toxic and about 70 that can cause cancer. Other primary preventions include avoiding areas where there are high amounts of toxic exhaust fumes or poor air quality, wearing a mask to protect against pollutants, and proper sanitation around the house to decrease the buildup of common asthma triggers, such as dust. Within the secondary level prevention, early detection and regular medical screening that eventually lead to referral of proper care are important. Allergen-specific immunotherapy helps detect what is restricting an individual's airways to properly breathe, and treatment is offered in the form of allergy shots. Allergy shots aid in an individual's body to gain immunity or resistance and can significantly reduce allergy symptoms. A specific allergen is injected in the body in small increments, and with that provides as an appropriate method of care once detection and screening tests are administered. Within the tertiary level of prevention, susceptible individuals should avoid the exposure of allergens or triggers of asthma. The use of anti-inflammatory medication has been attributed to preventing further progression of asthma to the development of chronic symptoms and reduction of mortality rates. The use of inhaled corticosteroids has also been effective in asthma management. Another thing to note is that although there is no cure for asthma, the condition can be controlled and enable people to enjoy a good quality of life. Importance and significance for public health and health education. To begin with, health is defined by Tropical Health Solutions as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Asthma is important and significant for public health and health education because it affects millions a year worldwide, with every 12th person being affected by asthma. According to Kaplan, a 2013 National Health Interview survey reported that symptoms from asthma resulted in nearly half of all school-age children to miss at least one or more school days. Children are one of the leading groups to be affected, and the problem could be improved with proper education. So it is important to implement courses on asthma, provide health services on campus, and heighten consciousness of building schools in areas of greater air quality. With that said, the number of students who miss school days could potentially decline.